But when it comes to planning long-term care, sorting through the options can be a daunting task. Most people don't even know where to begin. Well, Constellation Health Services is dedicated to helping seniors and the chronically ill, adults and their families. It's their job to get the right care at the right time and at the right price. Joining us today is the president and the CEO of Constellation Health Services, Joanne Walsh. Welcome to the show. Great to have you, Joanne.
Thank you, Desiree.
So let's talk a little bit about some of the challenges that seniors, but also their families face when it comes to thinking about care.
Okay. Basically, everybody would like to be in their own home if that's possible.
Right.
And adult children want to help their parents be as independent as they can, and they want to have the security and peace of mind of knowing that if they're not able to see their parents on a regular daily or weekly basis, that they're managing and that they're doing okay.
Can we talk a little bit about Constellation Geriatric Care Management, what that encompasses and what that's all about?
Sure. Geriatric care management is really a newly emerging field. It's a profession. Our geriatric care manager is certified and has been through some extensive training. And geriatric care managers really consult with families and with seniors about what kind of resources can be brought to bear to support them in being as independent as possible and as safe as possible, ideally in their own home, or if they're at an assisted living, sometimes we'll see it.
And they really know a little bit of everything, so that's what their job is, to kind of have everything kind of under their belt to kind of help you navigate your way through this process.
That's exactly right. That's what their expertise is. They come in and they look at the situation, and everybody's different. Everybody's situation is different. Everybody's health is different. And so they come in and they assess that person, where they're at right now, and really try and evaluate and develop a short and a long-term plan that focuses on that person and what they want.
So Jen, what kind of background, though, do you have to be a geriatric care manager?
Well, most geriatric care managers are either RNs or licensed clinical social workers that have been through a certification. And that certification involves really an understanding of entitlement programs like Medicare and Medicaid, housing, different kinds of housing, community services, and disease process. Many people start experiencing memory loss or early stage dementias. There are things that can be put in place so that they can be, supported and managed at home very effectively.
So what are some of the things you should consider, though, when you start thinking about geriatric care managing? If you're a family member that's looking at something like this, what should be going through your mind?
Well, I think you're wanting to just get the information. So many of the people that we see, the adult children, are professionals in their own right.
Right.
And, just because you're a professional, you're an engineer, doesn't mean that you understand what does Medicare do and what doesn't it do. Or is it time to be thinking about an assisted living, or can we bring in, a companion and handle things that way. The geriatric care management person comes in and knits a plan together for that person. They look at, okay, do you have family in the area? Are they able to come over and prepare meals or bring meals in once a week?
It sounds like it's kind of customized per each person.
That's exactly right.
And that's got to be a huge benefit to the families, to know that your loved one is in good hands, but also to know that everything that they love and what they do, that's all thought about.
Yes. That's exactly right. It's very personalized, and it's very, very specific. So, you can be looking at something that's today, what are we going to do? Because a lot of times things like this happen when there's a crisis. A hip gets broken, or some big change happens, and then there's an uproar and everybody's, frantic, running around.
But you
what should we do?
shouldn't wait to that point. You don't really have to now,
You don't have to. You don't have to. And there have been so many people that we've served over the last year where you can just see the person just relax. Oh, if only I had known that there was this resource. And that's really what it is. It's a resource to just help organize what are we going to do? What are the financial situation? What's the person's health condition? Do they live alone? Do they live with a spouse?
You said something earlier, and you said, I'm so excited to talk about geriatric care managing. Why were you so excited about it? Why are you so excited? Because it is new.
It is new. I'm excited about it because I think people don't realize there's so many people out there that are kind of struggling with, I feel like we need to be doing something and we're not sure what to do. And I look at a geriatric care manager as somebody that can come in and make an assessment and really provide a roadmap to a family about everything's fine if you just maybe thought about this one thing. If you just, maybe you need to have your parent evaluated. Maybe they need their medication looked at by their physician. Or maybe there's some outside resource that could be brought in on a limited basis that would make all the difference in the world to that person's safety and, you know, continued ability to be at home.
Thank you so much for talking with us, Joanne. I appreciate it. Folks, if you're watching right now and you have questions and you want to get in touch with Constellation Health Services, they have 2 locations. One is in Norwalk, and one new office now in Orange. The information's on the screen. The number is 1-800-332-1033, or come to our website, WTNH.com, and we will link you with their website for all those questions. Thank you once again so much.
Thank you.
All right, don't go